Well, that's an interesting story. If you look at all of the major health systems, so I think we're the second or third largest Catholic system in the country. So if you look at big systems, if you look at Baylor in Texas that has 9 hospitals, if you look at Ascension, big Catholic hospital system in the Midwest with 60 hospitals, more than half of them have a designated chief nurse officer, but a little less than half don't. So the journey has always been that we have very strong nurse leaders in each facility, and in each of our ministries, in long-term care and so forth. The Joint Commission always makes sure that that continues because you can't be accredited without a qualified, well-educated, designated nurse leader. Our system has always operated on setting the standards at the system level, but making sure that the local regions and ministries have the ability to do what they need to do the way they want to do it. So there has been a chief medical officer here for about 10 years that I know of. But 3 years ago, that physician position was converted to chief medical and quality officer. So that Dr. Martin, who's my clinical partner, was hired 3 years ago to be both physician leader and quality in the whole system. And a quality strategic plan was created that has, as its overriding tagline, no preventable deaths or injuries. And you and I, and anybody probably walking around who has experienced healthcare as a patient, knows that if you want to end preventable deaths or injuries, then you've got to have nursing as engaged, if not more, with medicine. And so, after about 1.5 years of Dr. Martin being in the position, it became glaringly apparent that he needed a partner and our patients needed us partnering together to do the right thing. So I often laugh saying, well, the sisters managed to go 150 years without somebody in my position, why now? But I know why. I know why. And Dr. Martin and I do very well together in role modeling how that relationship should look. I don't work for him, he doesn't work for me. We're absolutely partners in understanding the journey we take together. So we know that on some things he leads, on some things I lead, and on some things we stand together. So when we have to make sure nobody's doing wrong side surgery, he gets to lead. When I have to work on things like how do we make sure nobody gets a urinary tract infection that has a Foley catheter, I lead. But on most stuff, it's the two of us together. And that is to me a real joy, because neither nursing nor medicine has all the answers, but together we can collectively solve the problems. So there's another communication challenge for me. I probably spend more time speaking with physician audiences than I do with nursing audiences. Again, that translational stuff. But why is this role? I don't yet know. I just know with one vision and a lot of hope and a lot of support, nurses can change the world, and that's the way it is.